Hi, everyone, and welcome. Thanks for joining today. It's an important conversation about Drug Take Back Day, a critical effort to help keep our families and communities safe. My name is Mike Benson. I'm on the Executive Council with AARP Louisiana, and today I'm joined by Brice Mohundro, Manager of Pharmacy Population Health at Louisiana Blue. Brice is a pharmacist by training and works every day on strategies to improve medication safety and reduce harm across our state. So, Brice, thanks for joining us here today. Appreciate your time.
Good morning. Thanks for having me.
We'll dig right in. Tell us what people might not realize about how big of an issue unused meds can be.
So, we all have medications in our homes that are left over. Either we had a surgery, we got prescribed a pain medication, we didn't need to take it, so we've got it in our medicine cabinet. We didn't finish our antibiotic, or we're just on a medication that didn't work, and so we still have that in our cabinet. So what's bad about that is that it can be taken accidentally by someone else, it could be taken incorrectly, or it may fall into the wrong hands, kind of in that pain medication situation. And what we know is that a lot of people that end up being victims of substance use disorder got their medications from a family member or a friend.
A lot of times, if I don't finish a medication, which you always should, especially with antibiotics, I'm told, or if there was some sort of a pain medication that I just didn't need anymore and I put it aside, it's in a drawer somewhere. And then let's say months later, I remember I have that and I have some symptoms that I want to self-treat, which I know is wrong. But tell me about using prescriptions that might have been sitting around for a while. They do have expiration dates. Is it unsafe to use them at that point?
They do have expiration dates, and it really kind of depends on the medication. If it's let's say an anti-inflammatory, like a prescription ibuprofen or something like that, if you've got that around, as long as you haven't passed the expiration date that's on the bottle, you should be okay. But where it's not is in your example with the antibiotic. You don't want to, halfway finish the antibiotic, a couple of months later, start taking that antibiotic again. And that's really how we get, if you've heard the term antibiotic resistance. So that medication, that antibiotic, when you don't take it that full course, doesn't work as well as it would have had you completed that first course.
What about like pain creams or even some over-the-counter stuff that's been sitting around forever and you see the expiration was September of last year? Is it safe to throw that on your skin?
No, it's not. You should dispose of that medication once it's expired.
We often hear about the opioid epidemic on a national level, but can you talk to us about what it looks like here in Louisiana and why prevention efforts like this matter so much?
So yes, the state of Louisiana is not immune to the opioid epidemic. We have experienced a large number of deaths due to opioid use and opioid overdoses. And so one of the things that we can do to help combat the epidemic is to get the extra pain medication that is in the homes and in the communities into a safe space and out from in a place where they may be used inappropriately.
So there's no stigma about it. If somebody has opioids, and maybe a lot of them, should they be embarrassed to come to you and say, here, take these, we don't want them, we don't need them?
They should not. Drug Take Back Day is a safe space. It's anonymous. There's no questions asked. Over the years, we've had some emotional turning in of medication. Of the members that brought medication several years ago had boxes and boxes of fentanyl patches and tears in his eyes. Candace tells the story much better than I do, but really just, it's that relief that, if you get to that place and you just want to get it out of your home, there's no questions. There's no questions about why you have it, where it came from. It's just simply you drive through, you hand your medications over to the DE agent, and you're done.
No legal ramifications at all. No one's going to say, hey, what are you doing with this fentanyl, or how did you get it, or where did it come from? None of that.
Correct.
When and where is Drug Take Back Day happening, and what would one expect if they approach?
So Drug Take Back Day is actually a national event that's held by the Drug Enforcement Agency. And so there are many different locations around the state that will be available. So you can go to DEA.gov and look up where those different locations are. The one that we are holding here in Baton Rouge is going to be at the Baton Rouge Police Headquarters on Airline in the Old Women's Hospital building. And it's from 10 to 2 on Saturday, April 25th.
In today's world, people are very self-conscious about their privacy, and you mentioned it's at the Baton Rouge Police Department headquarters. That might raise some alarms with people with regard to how much privacy will be practiced. How do you reassure them that it's safe and okay to show up with a lot of drugs to turn in?
So it literally is just a line of cars. Think of, if you've seen on the news before, the drive-through flu shots where you roll down your window, you stick your arm out, you get your flu shot. It's very similar. So you just drive through, hand over your medications, and keep on driving. If someone is worried about the ramifications legally, there's also Blue Cross has partnered with the Attorney General over the past couple of years, and we have placed drug drop boxes, but it's available 24 hours a day. You go in, you open it, you drop your drugs, you walk away. There's no one there monitoring it. There's nobody there watching it. So that is another option to get the drugs out of a home, and also an option if you're not available on the date of the drug take back day events.
So I'm seeing there is a website people can go to, and I imagine our producers will put that up, but please tell us about that website, how to navigate it, to find some secure drop-off locations wherever you're watching this.
Yeah, so there is a louisianablue.com/safe drug drop. And it has a map and a locator, and you can identify where these different locations are, where these drop boxes are, where you can dispose of your leftover medications.
Okay, you'll likely see that in the crawl. Again, it's lablue.com/safe drug drop.
So do not bring any needles, syringes, those type of things, but liquids, tablets, creams, patches, inhalers, all of those other things are accepted at the drug take back day. And I really just think, I encourage you to all go look in your cabinets, your bathroom cabinets, if that's where you keep it, your kitchen cabinet, see if you have any leftover medications. And if you have any medications that you no longer use, make plans to go to either the Baton Rouge headquarters drug take back day or any of the other DEA sites on April 25th, or visit one of our drug drop boxes that we mentioned already.
Just a side thought, it occurred to me that often you'll see public service announcements from some charities, like not necessarily the food bank, but some places will encourage people to bring prescriptions to them to donate if they no longer use. Is that a safe way to go with prescriptions?
You can call St. Vincent de Paul locally, and sometimes they will accept it and sometimes they won't, but that would be a good if you're looking for someone. So for example, when my father passed away, we had bottles of a very expensive unopened chemo drug that they were able to take. So that is a good first option to look into. So that's St. Vincent de Paul as an option. And then if they're not able to take it, then you could go to one of the drug drop boxes or visit drug take back day.
How about pet medications?
Ooh, same, right? You don't want to keep expired pet medications. Our pets are our loved ones, just like our children are. And we don't want to give our pets an expired medication that may harm them as well. So those, if you have any leftover pet medications, are also welcome to be dropped off at Drug Take Back Day.
To everyone watching, Saturday, April 25th, 10 to 2, bring your unused or expired medications to Baton Rouge Police Department headquarters, free, easy, and open to the public. Together we can make small steps and make a big difference in the fight against the opioid epidemic. Thank you for tuning in, and please share this and help spread the word.